Hello there, everyone. My name is Katrina, and I will be sharing a couple of short stories with you about a wonderful person named Peter M. Talty. He is currently an occupational therapist and a professor at Florida Gulf Coast University. I met Professor Talty as a student in his Disease Impairment and Function course. During the course, he mentioned that he wrote 2 books. I chose one of them to do my project on. The name of this book is called Occupation as the Key to Change. Throughout this book, he gives suggestions for practicing healthcare and tells short stories about the encounters that he has had with his patients. Reflecting on his own experiences, including the role that occupation played in his life, has been very informative and inspirational. He describes these efforts to demonstrate that change within us is directly related to the change in our environments. Before he became an occupational therapist, he did not understand how powerful the kinds of occupations or activities that we participate in support or diminish one's health, well-being, and sense of self. He was able to become the manager of several OT programs, start a private practice, and become involved with OT organizations at the local, state, and national levels. Throughout the book, he refers to himself as an agent of change, meaning that it is his passion to help those change habits and adapt to their circumstances emotionally, physically, and mentally. There are 2 stories in particular that I feel really apply to the intention of this project. In the first story, there was a patient who was openly frustrated with her diagnosis of bilateral carpal tunnel syndrome. She worked as a bookkeeper and was very stressed about her inability to work and acquire income. After surgical treatment, she was still experiencing intense pain in her hand and was not benefiting from the results. Professor Talty attempted fluidotherapy, however, the weakness in her hand continued. Talty found out that the patient was a type 2 diabetic, pack-a-day smoker, and had horrible nutritional habits, all hindering her ability to recover from her condition. All of these occupations acted as barriers to her ability to heal from her surgery. Talty kindly explained to the patient how her smoking was probably hindering her hand from healing. He informed her that nicotine can have adverse effects on tissue repair and healing. The patient became sad when she recalled her past attempts to quit. After speaking with each other, the 2 of them understood her contributions to her own impaired health. He made no practitioner attempts to solve her problems, however, he continued to ask her questions that led to her accepting the responsibility for her current situation. He found it easier to work with her as she soon began small proactive changes to improving her health. As healthcare providers, we need to recognize positive opportunities for change and confront them. Persuading people to take certain steps that they may view unappealing or irrelevant to their situations is something that he struggles with. He now uses an approach that does not pressure them into changing the direction that they have chosen. Rather, he asks them more questions not only to better understand their situation, but hopefully to help them gain a different perspective. This came from the belief that people know best about their own situation and thus are the only ones who can solve it. Another interesting story was of a patient who was injured at the C7 in his spine and was paralyzed in both of his legs. The patient believed that God would help him walk again. This, however, was a cultural or religious barrier that kept him from following proper health protocols for those who are wheelchair bound. The patient began to develop pressure ulcers from sitting in the same position too long. Healthcare staff made attempts to encourage him to lay in the prone position. However, he was still convinced that God would eventually heal him of all of his wounds, and he continued his regular routine and prayer. He believed that once he would be able to walk again, that the ulcers would clear up. Talty decided that he was going to rig a gurney so that the patient would be able to move and propel himself just like someone would in a wheelchair. But the patient still refused. Talty did not give up and said that he would take it just in case. Talty found balance to work best. He tries to maintain hope while offering the just in case scenario. It helps patients participate in therapy and accept help from others without feeling diminished. As they become more involved in therapy, they not only improve their physical and emotional health, but also continue to work toward acceptance of the inevitable. In this approach, the patient isn't changing their belief system, but they are changing their behavior. As time passes, they may come to realize their previous thinking was inaccurate. When this realization occurs, the healthcare provider, as well as the rest of the staff and family, should be ready and willing to provide support to help them through it. His suggestions and stories give me influence and inspiration on how I desire to treat patients in the future. Here is a quote from his book that I believe applies to all of us in our intentions to be agents of change. Thank you for watching.